My name is Professor Christian Reich. I'm a dermatologist, immunologist by training. For 10 years I worked at the University Hospital in Göttingen, and now for the last decade I have been working here at the Dermatologikum. The patient was not in the focus at all 20 years ago. Now an enormous effort is being made to more look at the patient, and this is very justified. Let me give you one example. Our current disease severity classifications in all studies are very different from the patient disease severity classification. So a patient may say, I have severe disease, where a doctor would say, well, you don't. So what is really the relevant disease severity classification? So that's number one. That's to start with. The second is, what is a relevant outcome? Is it the physician being satisfied with a certain outcome, or should it not more be the patient being satisfied with a new outcome? And I tell you from my experience, even regulatory authorities are more interested in learning how big is the benefit you bring to a patient with a new therapy. And you have to ask the patient to find this out, than just being able to say, well, I had a PASI 75 response in 50% of the patients. I'm not saying that this is not relevant, but if we want to identify problems with the disease that a patient has, if we want to identify benefits that we bring to a patient with a therapy, we always have to ask the patients. And we may not have been perfect, this is at least my view, in the past, to bringing the patient in the center enough to ask, really go back and ask the patient, to put the patient in the center. This is in a nutshell what patient centricity should be and should bring to us, in my view.